So, respective faculties, now we are live on YouTube. So, Madan sir, shall I
Yeah,
proceed?
sure. Yeah, you can start.
Respective faculties, now we are live on YouTube.
Share the screen.
तो मैं उसी करूँ वीडियो
Prerna, you can mute others.
अपना खोल दो भाई जल्दी से उषा प्लीज खोल दो न्यू बैलेंस
Yes, Rakesh.
Yes, sir. So, good evening, everyone. Good evening, the respective faculties coming over here. So, I am Rakesh from Corona Remedies Limited. So, it's our great pleasure to welcome you all to this exclusive webinar, which is organized by the AMOGS Sexual Medicine Committee in association with the Uttar Pradesh Obstetric and Gynecology Society. So, now
You're audible, Rakesh. Please go ahead.
yes, actually, there is some glitch.
You can invite Dr. Madan by that time.
Slide not moving.
Yes,
Again,
actually.
reshare. Reshare. Next slide.
Yeah.
Yes.
Yes. So now I welcome to the conveners today, Dr. Madan Kamble and Dr. Prerna Keshan. So it's my pleasure to introduce Dr. Kamble, a visionary leadership in women's sexual health. So now Dr. Madan Kamble is a chairperson of the AMOGS Sexual Medicine Committee for 24 and 26, and it also serves as a national coordinator of FOXY Sexual Health and STI Committee for in 24 to 27. So Dr. Kamble drives to cutting edge, what do you call the advancement, clinical advancement in the vital field, and now, please join with me in welcoming him to share his insights today. Similarly, we have also Dr. Prerna Keshan. Dr. Prerna Keshan is the National Coordinator of YTB Committee, FOXY. So now I hand over to this webinar to Dr. Kamble. So, sir, please continue to this webinar, and I'm here to help you out if anything is required, sir.
Yes, thank you so much, Mr. Rakesh.
Yes.
It's my privilege to welcome you all on this virtual dais on behalf of AMOGS, entire AMOGS and AMOGS Sexual Medicine Committee. We are doing the webinars of this committee with many states of our FOXY, all the societies. This time we have we are covering Uttar Pradesh societies, and In this episode, we are covering 15 societies of Uttar Pradesh, and we are so happy to connect with Uttar Pradesh societies. And I'm very thankful to all the office bearers of societies. They have accepted our invitation and agreed to join for this. Also, I, on with the blessings of AMOGS office bearers, President Dr. Kiran Kurtkoti sir and Honorary Secretary Dr. Bipin Pandit sir, I take this privilege to welcome our guest. Today, we are so lucky to have chief guest, respected Dr. Jaydeep Malhotra ma'am, who is the past president of FOXY, and also the esteemed guest of honor, Dr. Amey Purandar sir, who is the president-elect AMOGS, Dr. Preeti Kumar ma'am, who is the vice president FOXY North Zone, Dr. Yashodhara Pradeep ma'am, who is the senior, very loving person, with past president of vice president FOXY, and also I welcome Dr. Sadhana Gupta ma'am, Vice Chair ICOG. I welcome my co-convener Prerna and today's speakers Dr. Tamkeen ma'am, Dr. Veena ma'am, all the chairpersons from all the UP societies, and also expert Dr. Asha Mishra ma'am, Dr. Sambul ma'am, and all the respected panelists. AMOG Sexual Medicine Committee and also FOXY Sexual Medicine Committee is always trying to create the and spread the awareness regarding the sexual health. As we know, the sexual health is an integral part of the women's health. We all are working so hard for that, and we are so privileged to have the wonderful guest. So uh, I welcome our chief guest, Dr. Jaydeep ma'am. Rakesh, can I have a slide? Rakesh. Everyone knows Jaydeep ma'am is the past president of FOXY, very loving lady. Whenever we met, ma'am is so cool and down to earth. uh, yes, we welcome you, ma'am. Over to you for your blessings.
Thank you. Thank you so much, Dr. Madan. Very, very good evening to all of you. It's such a pleasure to be part of a webinar, which actually is something which is the need of the time and our population. It's really, really important area because it is very, little has been talked about it, and reaching out to the population is something which is the most difficult part. So creating awareness amongst our fellow beings and then going on and translating it into reaching out to the population is something which is a very difficult task. And I really congratulate AMOGS, especially because you have taken up a task which is a very important one. And I was really happy to see the topics which are, very well chosen. Again, the guests of honor, all very, very eminent people who I'm sure know that this is one area which needs our attention. And I feel that you have really carefully chosen all the guests of honor, also very dynamic people who are going to carry forward the efforts which your committee and AMOGS has been doing, and I'm sure FOXY committees are also looking forward. So this collaboration is also very important between FOXY and the other organizations, sister organizations which are there, because together only we can reach out to the maximum population. And as I see Amya, Preeti, Sadhna, and Yashodhara, and then the speakers, Tamkeen and Dr. Veena, and of course you and Prerna are going to, do the panel. Uh, Teenage pregnancy used to be talked about a lot a few decades before, and then in between it lost, its relevance. Because today, most of the times when we were discussing a few days back, everyone was saying, oh, everyone's marrying late and, these pregnancies are not really happening. That's really not true. And it's still quite rampant, and but though it may be a little regional, and it definitely needs our attention. And social media is again a very burning topic. I'm really looking forward to hearing this, because how do we really tackle this menace is a very important aspect. Because if you have seen the news today or yesterday, there have been so many repercussions of this social media interaction between our children. And that's something which is a real horror story. So, really looking forward to hearing on this particular talk. And of course, the psychosexual issues are which are not really talked about. So, this will give us confidence to our members on how to tackle all these situations. And I really wish you and AMOGS all the best, for all your endeavors, and really looking forward to hearing everyone. Thank you so much for having me. Thank you.
Thank you so much, ma'am. Your wonderful words and blessings as always. Thank you so much, ma'am. Rakesh, we welcome our guest of honor, senior ma'am, the loving lady, and met many times virtually, Dr. Yashodhara Pradeep, ma'am. I welcome madam for your blessings. Ma'am is the past vice president of Foxy, and very dynamic Foxian, and she has worked a lot in her tenure. We know, everyone knows. Over to you, ma'am, Yashodhara, ma'am, for your blessings.
Uh, Thank you very much, Dr. Madan Kamble. And heartiest congratulations to you and Dr. Prerna Keshan. As it has been already said, it's a really burning topic which we were trying to escape for a long time, because this sexual health and sexually transmitted diseases are not new. But anyhow, we were not um, contacting them directly. But now the generation has changed. It is a Gen Z and Gen Alpha. They're absolutely different generations, and they are the digital people. So they want everything to be on their fingertips. So if you see them, there's a two in India, you always see the extremes. They have one extreme which is illiterate and not knowing much, but there is another generation which is, we all in the media we can see that Gen Z and Gen Alpha. So Gen Alpha leave behind it because they are just growing, but by the time we will start, they will be there. So this is a very important thing to talk about sexual health, and very important topics you have kept on the point that this is Dr. Veena Gupta, very eminent speaker from Allahabad, impact on social media on adolescent health. And Dr. Tamkeen Khan is going to speak on the teenage pregnancy. And your panel, psychosexual issues in adolescent, sorry, it is very, very important. It is very important. And I really appreciate your efforts to adjoin 16 societies from the Uttar Pradesh to bring them on the common platform, and involving them is a great effort. I really appreciate you, Dr. Madan. And thank you once again to bringing this topic of a very, very needed program. It is not only the teenage pregnancy, because it is decreasing. It is the sexual health which is very important. And recently in AICOG, I had a panel of 40 minutes on sexual reproductive health, client-centered approach. That health strategies, client-centered approach. So this is what we actually need at the moment. So thank you very much for inviting me, and my blessings are with you and Dr. Prerna, who is from the YTPC committee, all the chairperson from Agra, Dr. Niharika, very well known, Dr. Richa Singh, very well known, from Aligarh, Dr. Sumbul, and Dr. Tamkeen Khan is a very eminent speaker. From Allahabad, Dr. Veena Gupta, Dr. Amrita Chaurasia. So they are all very well known. From the Hapur, there are three people are there, Dr. Asha Mishra, Dr. Uma Gupta, and Dr. Renu Bansal. From Ghaziabad, probably Dr. Alpana Bansal is one of our student only, and she's chairing the session. I'm so happy to see it. From KGMU, he is probably. And she can confirm it, because she used to be Alpana Kansai probably before that. And then we are having from Jhansi, Dr. Vidya Chaudhary, from Greater Noida, Dr. Archana Mehta, and many, many. So I'm sure that they are going to do justice, and I'm here to listen to the topic. Such an interesting topic. I also think that I am also going to gain some knowledge about it. So it's a very, very open topic, and thank you very much.
Thank you, ma'am. That was indeed
My blessings
honor to
are
have you.
all with you for your future endeavors. I want to see this young generation to grow high and high.
Thank you, ma'am. Thank you. We are so very honored to have you amongst us, ma'am. Wishing you all a very good evening once again, and warm welcome to this esteemed string of panelists and string of stalwarts we have. And we have heard from a very beloved Madam Dr. Jaydeep Malhotra ma'am and Dr. Yashodhara Pradeep ma'am. And we have pathfinders of Foxy with us today, the steering force for all of us young gynecologists across the nation, the torch bearers of excellence in academics, and the diamonds in the field of stalwart, pioneers in the field of gynecology. We have with us Dr. Preeti Kumar, ma'am, Vice President Foxy North Zone. Ma'am, we welcome you for your words of wisdom. And we have Dr. Sadhana Gupta, ma'am. Ma'am is the Vice Chair of ICOG. Ma'am, the dais is all yours. Dr. Sadhana Gupta, ma'am.
Thank you, Prerna, and thank you, first of all, Madan and Prerna, for this invite. And my sincere regards to Dr. Kiran Kutkoti, Dr. Vipin Pandit, who are President and Secretary of AMOGS, and our Dr. Jaydeep Malhotra, past President, and my all co-guest of honor, Dr. Mia Preeti Yashodhara ji, and I welcome everyone. So, first of all the best wishes to Madan Kamble and the Prerna. So first thing first, and Madan, आपका तो नाम ही मदन है. So I think you are set destined for this chairing sexual medicine committee. And it's a really great effort that you are like connecting with the all Uttar Pradesh societies, and I see all very academician people, very senior as well as the young people in the program. So it's a great pleasure, and you have crafted a very relevant like program actually, which is stimulating and which must be thought provoking. So few things about this, that time is changing that radically that we are not able to grasp it. We actually don't know the answers, and only the time will teach us that what to be, how to be, like tackling with the new, what Madam has said, Gen G and Gen Alpha, how to deal with them. And totally, I think that our generation and even our junior, like a parents of the young children and the adolescent are totally at loss when the relationship between parents and teachers, parents and their children, teachers and the student, and everything is being changed because we are being bombarded 24/7 by so many people who are actually changing our brain set. So it is not only sex, it is a politics, it is everything which is actually being conditioned by so many forces which are remote, they are in which world we don't know. So teenage pregnancy is taking totally new shape. So it is a adolescent sexuality, and it is very difficult. The early dating was something very distant thing in our adolescent. Now it is our even like a dating apps are there. So we actually are totally at loss. And this is the time, like Madan and Prerna, like you are going for the Foxy leadership, that we need to be grounded in certain very like a value-based sexuality. And where is we cannot do anything about only copying the Western world and what are their recommendation and what are their experience. And this is the urgent need of time, that our people, our young people's concern should be spoken of, our experience are valued, and we find the solutions to our challenges from our own experience. So this is something which I think this is very important, where the sex has been a very positive value in Indian philosophy. It is for a like a reproducing and having a children, young generation, which has got the high character. So that was the sexuality, and it is not a sex and violence which is being sold on the social media. The Brooks and the government of India is like putting that what should be like, they are taking back, and everybody feels unsafe, and we are chewing sex like pathologically 24/7. So this is something much to do from the sexual medicine committee, and we wish that we will have a totally new insight and new ways to deal with all these issues. So again, my regards to all seniors and all colleagues and all junior friend, loving regards to everyone who is today in their program. Congratulate Madan and Prerna for this like opening up the discussion, and we look forward to great program, and our all best wishes to both of you. So thank you.
Thank you so much, ma'am.
so much,
Dr. Madan, please convey my regards to Dr. Kukreti, Dr. Vipin Pandit,
Yes,
and
yes, ma'am, sure.
Dr. Amya,
Yes,
because
sure. Yeah,
and
Ame sir will
AMOGS,
join.
because this AMOG is a very reputed society, I know.
Yes, yes, ma'am. Ame sir is joining.
Yeah.
Yes,
Thank
Prerna.
you, Sadhana
Yes.
ma'am. Yes, thank you, Sadhana ma'am,
Yeah.
for your words of wisdom. It's indeed a pleasure and an honor to and a treat to hear you speak always. And we look forward to so many more things under your guidance and leadership in the ICOG. We have with us somebody whose achievements speak for herself, and she has set a benchmark for maternal health across the nation. And with her new installing as the Vice President of North Zone, we look forward towards more higher realm of excellence under her leadership. We have Dr. Preeti Kumar ma'am with us as one of our guests of honors. Dr. Preeti Kumar ma'am, are you there?
Thank you. Thank you so much,
Okay.
Prerna.
Yes,
Am I
ma'am.
audible right now?
Yes, ma'am. Yes,
Yes,
welcome,
ma'am.
ma'am.
So first and foremost, let me first of all give you warm regards to all the seniors and dignitaries who have joined today, including my teacher, Dr. Yashodhara Madam, and Dr. Jaideep ji, Sadhana ji, whom I have already, always admired, and she had been an inspiration for me. Madan and Prerna, few words for you all. I've seen you working in Foxy for so many years. Madan, I have seen you working in the sexual health committee with Neeraj and also with Apurva. And you have a lot of experience, and you are very dedicated and a passionate person. And I wish you all the best. And this is the reason I always try to join all your webinars in so, and also the Prerna Kishan, I have seen her working for many of the projects in Foxy, and very hardworking girl. And she's also very active in Manita. So I look a lot of enthusiasm and passion in Prerna as well. So wish you both good luck, and I'm sure, quite sure that both of you will sail through this election, and will do a lot of work for Foxy. Now, coming to the topic today, I think a lot has been spoken about it. And Dr. Jaideep, Dr. Yashodhara Pradeep Madam, and Sadhana ji has already talked about it. But I just want to focus here is that when I was working in Meghalaya, the northeast part, uh, anemia and teenage pregnancies are the two very common challenges where what they are facing. Almost 40% of the teenage pregnancy happen in that area. So northeast is the region where teenage pregnancy is very common, and we need to focus on that area. And I welcome all the faculty members who have joined from all the various societies on a very important discussion, the teenage pregnancy and psychosocial aspect, and the social media, all those relevant topics you have taken. But I would like you to focus on the northeast part, where you need to spread awareness also in the community, because unless until the community also there's a awareness in the community, this teenage pregnancy is not going to drop. So I think it's a huge challenge for a country, and we need to work hard for it. And I can see Amay. Welcome, Amay. And you have, all very good and very learned speakers from UP. Wish you all the best. And I'm here to listen to all the deliberations. Thank you so much.
Thank you so much, Preeti ma'am. Thank you so much. You are always with AMOGS and
Both
with
of
me
you
also. Your
ensure
blessings.
that I join. I get so many calls from you and Prerna, and you make us all, join the webinar. So we are always there for you. Thank you so
Yeah.
I
much.
hope
And
ma'am, your
yeah.
spondylitis is hurting less. Instead of
Thank you,
all
ma'am.
your health hazards, still you are in. So that is a warm pleasure for us, ma'am. Thank you so much for being here.
Yeah.
Dr. Madan, you can introduce Dr.
Yes.
Amya.
No, no, please introduce. Please introduce, Amish. Rakesh, no, can I have the CV of Amish? Prerna, you can introduce.
Yes. So we have with us another steer leader for AMOGS, the president-elect of AMOGS, Dr. Amir Purandare, sir. And as we have stated in the previous meetings, I have been an honorary member of AMOGS and have been adopted by AMOGS, as Dr. Madan and Dr. Kiran has always been saying this to me. So much love I have got from AMOGS. It's such a warm pleasure to introduce you, sir. Sir is the consultant OBGYN from Purandare Hospital at KG Somaya Medical College. He is the senior vice president of AMOGS 2426 and a joint secretary of FOXI in 2020 and 2019. Sir has numerous awards and affiliations to his credit, and we are so very honored, sir, to have you amongst us. You're one of the pathfinders for all young generations of FOXI, and your achievements speak and serve. Thank you so much, sir, for being here. We are for your words of wisdom.
Yeah. Thank you, Prerna, for those kind words. Thank you, Madan, for this invite. It gives me great pleasure to be with you this evening as guest of honor for this webinar on key issues in sexual health, namely teenage pregnancy, the impact of social media on adolescents, where on one side it could be extremely useful and informative, but on the other side it could be easily misused and misdirected. So I think as doctors, we need to play an important role in how we channelize the information that is put on social media and how our patients interpret it. Third, the adolescents are the future of our country and of the world, and therefore we need to ensure that we protect them, nurture them, mentor them, inspire them, and coach them properly. And I think health is one of the key issues where they require all this. As women healthcare providers, we have this very important responsibility to our adolescents. And as you know, adolescents are the growing part of our population, the majority part of the population. So I think very well chosen topics by Madan and Prerna. It gives me great pleasure to see Dr. Jaideep Malhotra, Dr. Yashodhara, Pradeep, Dr. Preeti Kumar amongst us, and all our esteemed faculty from across India. So I'm happy to be here. Last but not the least, Madan and Prerna, please keep your commitment and your resolve uh, to Foxy going. Always, you are indeed value adds to the future of Foxy, and I hope to see you in important roles in Foxy in the years to come. Wishing you all the best towards that, and keep working hard and coming up with such important scientific programs. Thank you once again.
Thank you
Last
so
but
much, sir.
last but not the least, looking forward to welcoming all of you for the AMOGS conference on 13th, 14th, and 15th of March in Mumbai, where we are going to have a feast of academics, festivities, celebration, fellowship, and social initiatives all put together.
Thank you so much, sir. It's always a treat to hear you speak, and your words are beyond inspirational motivation for us. Thank you so much, sir, for being here. We now move on to our scientific sessions, and we once again thank all our esteemed guests and guest of honor, the chief guest, for being here with us today. To please ignore.
Yeah.
Dr. Madan,
Also, yeah, we welcome Dr. T.S.S. Rao sir also, who is a great person in sexual health from JSS University, Mysore, well-known person in the field of sexual medicine. Welcome you, sir. Yeah. Thank you once again, all the faculties, chief guests, and guest of honors. And on behalf of me and Prerna, we appeal all the seniors in the FOXY and all the office bearers of UP societies to kindly support and vote us for the FOXY elections, upcoming elections in August 26 for the post of chairpersons, YTP committee and sexual health committee. Thank you once again. Now we will move forward to the scientific programs. Yes, first session, I would like to invite our chairpersons, Dr. Niharika Malhotra. Everyone knows Dr. Niharika, very good friend of all the Foxians, very active and dynamic person. She's the past chairperson of YTP Committee of FOXY. Dr. Vidya Chaudhary ma'am from Jhansi Society, Dr. Archana Mehta ma'am, who is the president of Greater Noida Society, and Dr. Alpana Agarwal ma'am, who is the president of Ghaziabad Society. I welcome all the esteemed chairpersons, and I request Dr. Vidya ma'am to introduce the speaker, Dr. Tamkin Kham ma'am.
Good evening. Good evening. Am I audible?
Yes, ma'am, please.
Okay, please share. Okay, today's the topic is very good. It is not visible. Screen is not visible.
Just
I know Dr. Tamkeen, madam. She is a very bold and a very excellent orator.
Yes.
It is not sharing. Screen is not. CV is not sharing.
started sharing. Can you
Tamkin
see
ma'am,
my
DP is also of a oration DP.
Yeah, ma'am. She is a very good. Madam is very good and bold orator. Should I speak or CV or?
Yeah, you can read. Rakesh, is there any problem?
No,
CV
no.
is not.
Can you see my
Madam is
screen?
sharing.
Your screen is visible. The
Okay.
thing is that you can go to directly your PPT. Therefore, you can able to present. Your
So you
screen
can
is
see my
visible.
PPT? Can everybody see my
You can
PPT,
open
please?
your PPT, ma'am.
No,
Your
it is
PPT
not.
is not
PPT
open,
is
I
not
suppose.
seen.
Oh, let me again share
Yeah, yeah.
once more. Can you see it now?
Yes.
Yeah, it is visible, ma'am. It is visible
Okay.
now.
So thank you so much for inviting me here, all respected chairpersons, other faculty who have joined together, and members of the 16 societies that Dr. Prerna has brought together. Thank you so much. So many past presidents and renowned faces that are here today. Thank you so much for connecting us all together, Dr. Prerna. Uh, I'm going to talk about teen pregnancy. We have all seen this serial and waited eagerly for the next episode, but and enjoyed it as well. But when I'm taking around early in the morning and I meet a 14-year-old who delivered a stillborn baby, or who's throwing a fit, or who's being judged because she was in a consensual relationship and she's unmarried by the residents, or because the pregnancy that she's carrying is as a result of sexual abuse. We all know how we define adolescent pregnancy when it is under 20 years of age. It is a problem of both developed and developing world. But when you imagine a teenager who has suddenly to deal with a baby, and how his or her life can suddenly take an unexpected turn while she's still figuring out things. So, teen pregnancy isn't just a statistic, it's a real story of dreams being derailed, facing judgment, confronting challenges at the social, familial, economic, emotional, and physical levels. It's a human rights issue. They are forced to leave school, are denied their right to education and her right to health, neither physically nor psychologically ready for the pregnancy, and more vulnerable for complications with devastating health consequences. They stop school, compromise income earning later on, and miss opportunities, and this perpetuates the cycle of poverty. Let's see what the numbers say. WHO says 2019, an estimated 21 million teen pregnancies occurred globally, of which 50% were unplanned. 64.5 teen births per thousand females were reported in 2000, whereas they decreased to 42.5 per thousand in 2021. But there is much less decrease in Southeast Asia and in our part of the world. Preventing adolescents' pregnancy related mortality and morbidity is important for achieving our SDGs related to maternal and newborn health. Let's look at the Indian scenario. 7.9% of girls aged between 15 to 19 were either mothers or pregnant in 2021. Rural areas have significantly higher rates than urban. Bihar, Assam, West Bengal, and as Dr. Preeti mentioned, Northeast, they report the highest rates, while Delhi shows lesser rates. The root cause being lack of education, poverty, early marriage, and limited access to sexual health services. Child marriage is illegal, we all know. But 1 in 4 girls in rural India is married before reaching 18. Lack of proper sex education and access to contraception leads to a pregnancy which is not a choice, but a consequence of a system that has overlooked its needs. And then the role of culture. All girls are perceived as burdens, and early marriage is a solution to alleviate those burdens. Conversations about contraception or sexual health are a taboo, leaving girls ill equipped to protect themselves. Pregnant teenagers endure judgment from society and from their old families. And this again generates a cycle of shame, hindering them from seeking further help. And I noticed that even when the age is written that she's just 14 or 15 years old on the face of a girl, the Aadhaar card shows that she's 22 years. Why? Because getting married at less than 18 years is illegal in our society. What are the obstetric implications? 55% of these pregnancies end in abortions because they are unintended. And these are unsafe abortions in LMICs. They face a lot of high risk of eclampsia, puerperal endometritis, infections, and also complications in the baby. I looked up at if there were any guidelines from ACOG or RCOG or any other society and found that there was one guideline in 2017 which was subsequently withdrawn in 2022. This is the only guideline I could find from the Canadian Obstetrics and Gynecological Society, and most of my talk is based on that. So, what are the prenatal, perinatal, and postpartum care for adolescents? आशी बहुत तेज शोर हो रहा है प्लीज एक्सक्यूज मी आशी 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 बहुत तेज शोर हो रहा है so let's talk about the prenatal and the antepartum and the postpartum complications. We all know adolescents need adolescent centered prenatal care, which means we need the care to be adapted to adolescent needs. It has to be multidisciplinary, easily accessible, one site model preferred, adolescents present later than adults, and developmentally appropriate care should be there, which is sensitive to their developmental stage. At the same time, adolescent pregnancies are high risk pregnancies, and we need to provide them high risk pregnancy management. So, programs must manage risk and address unique physical needs. They should include partners, fathers, mothers in the visits and provide prenatal and infant care education at every visit. The first problem is that there is a misdiagnosis of pregnancy because many of these girls will have an irregular cycle at this age. And this delayed diagnosis may result in no care or delayed care. So early ultrasound is a must to confirm the pregnancy and for accurate dating and also to assess and manage preterm birth risk. Pregnancy options counseling. Once you have confirmed the pregnancy, we need to discuss with them whether they would like to terminate the pregnancy, whether they are ready for adoption, or whether they want to continue the parenting. The abortion, remember, may be spontaneous or induced and can result in maternal complications in the form of a septic abortion, and in the long term, it may lead to PID and subsequent infertility. Assess her nutrition, vitamins, and food support. Counseling has to be done regarding that, and think of anemia because it may lead to further low birth weight. Anemia in pregnancy per se is not caused by young age. Poor eating habits and infrequent antenatal care may make them more vulnerable to anemia. Prevalence of anemia in adolescents is 41% in Indian studies, and very high in adolescent pregnancies, as high as 62%. And the commonest, of course, is iron deficiency anemia. Then there are developmental issues related to the nutritional requirements. because the body is growing herself as well as the baby is growing inside her. Over and above, they need to fulfill the demand for the pregnancy. So, failure to meet the demand affects the growth of both the mother and the infant. Ultrasound at 16 to 20 weeks, because they have higher anomalies, anomaly rates. Mainly it is the pelvis anomalies, the GI tract anomalies, musculoskeletal skeletal anomalies. The exact reason is not known, but body mass index before pregnancy, folic acid, and other multivitamin requirements before and during pregnancy have been implicated. We need to screen them for STI and BV, bacterial vaginosis screening. Test at the first visit and the third trimester, and of course, postpartum. And we know that 1 in 4 adolescent females who are sexually active may have STDs, chlamydia, or HPV. More common in sexually active due to behavioral, biological, and cultural reasons, like increased cervical ectopy, making cells more susceptible to infection, multiple partners, and barriers to accessing care. So, STI and BV management has to be done, and test of cure has to be seen after 3 to 4 weeks. Treat partners and encourage them to use condoms. Pre-prom and preterm labor is also very common. The rate of preterm birth for teenage pregnancies is 11% as compared to 7 according to WHO. Risk factors include shorter length of the cervix because the uterus has not grown well, increased incidence of the UTI and lower genital tract infections, and the developing uterus, the size of the developing uterus. Risk of preterm birth in pregnant adolescents is higher than adult pregnancy. It is 25% among white adolescents and 39% among blacks. The reason for no or late antenatal care, social deprivation, physical abuse, smoking, and substance abuse that is associated with teen pregnancy. Psychosocial screening is also important, along with screening for alcohol, substance abuse, and domestic violence or partner violence. Mental health screening is important, routine mood disorder screening, and in each trimester screen for mental health, and also at the time of postpartum. 2 times higher rates of depression are seen in these pregnancies, both prenatally and postpartum, and low self esteem due to poverty, partner violence, and dysfunctional family relationships. 19% of reports show that these women, they think 19% of these women, these teens think of suicide, and 9% may have attempted a suicide. At risk of post traumatic stress disorder because of physical attacks by the partner, neglect, and abuse by the parent. So, pregnant adolescents are more likely to smoke and use alcohol, which may again complicate the pregnancy further. Teenage marriages break up faster than other marriages and have the highest divorce rate of all. At the same time, there's a high risk of small for gestational age and low birth weight, which is 1.5 to 2 times more common, and improper maternal growth during adolescence may have a detrimental impact on presentation and may cause fetal growth restriction. That is the postulated mechanism. So we need to do a growth monitoring, especially at 30 to 34 weeks, and keep on screening for FGR. Hypertension and GDM are common, but hypertension is more common in this population. GDM is the background rate that is there. So in India, eclampsia has a background rate of 10%, which increases twofold in these women. They are more likely to, because of an underdeveloped uterus, which may affect deserialization, spiral artery remodeling, and deep placentation, leading to high incidence of PIH. Then the visit frequency for antenatal checkups should be more frequent, and every time educate them about the risks. Delivery should be in a hospital. They have a surprisingly higher vaginal delivery rates, lower C-section rates, and multidisciplinary care is required. Remember to provide them respectful care in the form of privacy and, most important, non-judgmental care. Prolonged labor, the incidence is 4% among younger females and lesser as they age. This may be directly due to fetopelvic disproportion. Birth injuries are also more common because of small capacity of the pelvis and operative deliveries, leading to hemorrhage. Mode of delivery, now this is again something surprising. Last study has found that they have greater rates of spontaneous vaginal delivery because they have smaller babies as well, and lower rates of cesarean and operative delivery. The highest disparities were observed in the youngest adolescents with an odds ratio of 0.26 for patients younger than 16 years, according to this study that I have put right at the right hand side corner. So postpartum hemorrhage are reported to have greater rates of PPH despite lower rates of cesarean deliveries. Maternal mortality is higher, and ratio for adolescents is 260 maternal deaths per 100,000, whereas it is 190 per 100,000 for the adult women. Breastfeeding support is recommended, and we need a very strong support, parenting education, depression screening, and helping them increase the birth spacing. So, discuss contraception before delivery, during the antenatal period, promote LARC, and prevent repeat pregnancy. That is, a pregnancy occurring within 2 years, and the incidence is very high. 35% of recently pregnant women, about 65 of them will have unplanned pregnancy, and they will become pregnant within 2 years. So rapid repeat births defined as they become more challenging to continue education, find an appropriate job, and secure income for a teenager with more than one baby. They should therefore receive individualized, non coercive counseling on contraceptions and spacing. Counseling should start, I already said, prenatal stage, and should be discussed before they leave the hospital. Again, screen for postpartum depression because they are more likely than adults to experience this. They have less social support and more parenting stress. The mother's postpartum depression has an impact on a developing child, so it is important for the baby as well. It is associated with developmental delays in these babies at 18 months of age. So, adolescent mothers are more likely to have a teen parent or no parent, live in a dysfunctional family, have issues such as substance abuse, have experienced childhood trauma, or have become pregnant due to sexual abuse. The care providers need to understand the background of these cases in order to prevent a rapid repeat pregnancy and involve multidisciplinary workers in the network. Long-term outcome, pregnancy in adolescents may lead to negative socioeconomic outcomes and health inequities in both the mother and a child, which may continue throughout life. So economic challenges for the mother and baby may be there. Then negative parenting, adolescent mothers have difficulty practicing successful parenting behaviors and have unfavorable parenting habits. When engaging with a teen parent, parent education is crucial because this will affect the baby. So neonatal morbidities and the stillbirth rate is also high as compared to adult pregnancies, and other complications like neonatal asphyxia is also, and jaundice is also common. They have a highest infant mortality rate, 15 per thousand, and as in this age group. And however, when we compare them to women and 45 to 54 years, then it is slightly lesser. Long term, I already discussed, they have problems, the children have problems, low cognitive and social stimulation leading to poor academic achievement and malnutrition. They are also at increased risk of abuse and neglect, and boys are more likely to be incarcerated. Girls are also likely to be teenage mothers. So, moving forwards, breaking the cycle of teenage pregnancies requires a multi pronged approach, starts with education, comprehensive sex education in schools, laws against child marriage must be enforced more strictly, healthcare access should be expanded to rural and marginalized communities. So let's all empower young minds today and brighten their futures. As obstetricians, the it is not our duty just to control the quantity of the future generation. It is our responsibility also to control the quality of the future generation. So let's rewrite the narrative for India's youth. WHO has released these new guidelines which make it imperative that there should be proper policy and recognize and address the needs of married girls. We should meaningfully engage adolescents, increase contraception access, and promote correct and consistent use of condoms. I was looking at various guidelines. I couldn't find any for India, but I was surprised that in Uganda, you have a guideline dedicated to manage teen pregnancy. So if they can have it in Africa, why not in India? So pregnancy in adolescence, it is time to get together and address Generation Z and Alpha, as Dr. Yashodhara said, and Let's all work together. This is about blaming or judging anyone. It is about acknowledging that the issue is complex, deeply rooted in our society. Addressing it requires awareness, empathy, and accessible resources so that young people can navigate these challenges without fear or stigma. Their vulnerabilities, coupled with their sexual experiences, need more contemplation for all of us, and appeal to this Adolescent Health Society to work on these guidelines. Thank you very much.
Thank you so much, ma'am. That was indeed an elaborate and extremely informative session on teenage pregnancy. I invite our chairpersons, Dr. Niharika Malhotra and Dr. Vidya ma'am, Dr.
Thank you.
Archana ma'am.
Thank you, Dr. Prerna and Dr. Madan, for this wonderful webinar. And Tamkeen ma'am, it is always so much inspiration hearing you every time. Just to tell everyone here, Tamkeen ma'am is also the founder secretary of the Stillbirth Society, and I've seen her tirelessly working for this cause everywhere all over India. We understand that rising teen pregnancies is sending us a clear message that we have to work for our youth. And I think together, if we provide that stability, it can echo throughout the entire future generation. And I am sure that our small efforts will someday become big and we will bring the change. So thank you, Tamkeen ma'am, for bringing this thought provoking lecture today. And thank you, Prerna. Thank you, Dr. Madan.
Thank you,
Archana
Niharika.
Mehta is also here. Archana
Thank you
ma'am,
so
you're
much.
Yeah, thank you so much. At the outset, I would like to thank Dr. Madan, Dr. Prerna, AMOGS Sexual Medicine Committee for giving us opportunity to be part of this very important and informative webinar. And rightly said by Dr. Niharika, Dr. Tamkin Khan had given insightful, powerful, and very comprehensive talk on teenage pregnancy. You know, pregnancy is the most beautiful journey for any woman, and it brings with it so much joy, excitement, and good news. But when a teenager conceives, it is no more of good news, because it with it comes negative social and medical implications on the health of mother and baby. And ma'am has, I think, covered all aspects, starting from the epidemiology. And we think that females are getting married late, but now we see that in rural area it is still a public health concern. So many driving factors are there for this increased teenage pregnancy. And I think ma'am has covered all aspects, starting from specialized prenatal care, special postpartum care, and how to prevent, because prevention is always better. So ma'am has beautifully explained multi-pronged approach and the importance of comprehensive sexual health. So we have to work on that, and we hope that we would like to bring this teenage pregnancy on a very low the incidence. We could do something, and we as gynecologists we should work on this basically by spreading the awareness and access to contraception. And I think empowering the youth, it can go a long way to bring this incidence of teenage pregnancy lower. So thank you so much, Dr. Tamkin Khan, ma'am. Thank you so much.
We also have Dr. Vidya Chaudhary ma'am and Dr. Alpana Agarwal ma'am with us. Ma'am, your inputs, please. Vidya ma'am.
Yeah, thank you. Congratulations again, ma'am, for simplifying such a complex issue. Teenage pregnancy is a really complex issue. And translating this topic is where we have to make the policies and coming it into the practical actionable insights. And it is a very, I think it is a good, you have covered all the thing as the madam said, all the Niharika, Dr. Niharika and Dr. Archana Mehta. We have to go beyond the labor room. I think all the gynecologists should go out of the labor room to the community and to counsel, because the prevention is better than the cure to avoid the teenage pregnancy. So I think it is congratulations, Tamkeen ma'am, for such a wonderful and insight on this topic. It's really good to hear you always. I am very,
Thank you, Vidya
very
ma'am.
fond of
Dr.
you.
Alpana ma'am.
Thank you.
Alpana ma'am. Alpana Agarwal ma'am. Do we have Dr. Alpana ma'am with us? So once again, we thank our speaker and all our esteemed chairpersons for a very, very insightful input on this particular very sensitive teenage pregnancy, which is less talked about.
And we need to understand how deep we, as Dr. Niharika has mentioned, we need to work for the youth of the country. With the rising trend of teenage pregnancies, we can sort out that. So with that, we move on to our very next session, our academic session, and we have Dr. Veena Gupta ma'am. She's the president of Allahabad Society. And to chair this session, we introduce Dr. Beena Singh ma'am, secretary of Bijnor Society, Dr. Prerna, the president of Firozabad Society, and Dr. Upma Jaiswal ma'am, secretary Gorakhpur Society. We welcome all our esteemed chairpersons to share this particular very, very important and pertinent topic of impact of social media on adolescent health and sexuality, which is a burning topic in today's date. As Dr. Jaideep Malhotra ma'am in her opening address said that we have heard and every now and then, and the very burning topic in today's date, that 3 girls that got suicide done because of this particular impact of social media. So this is very, very burning topic we need to discuss, and I hope Dr. Veena Gupta will be delivering her address in a pertinent manner. So that is, I welcome our chairpersons to introduce our speaker, Dr. Veena ma'am. Do we have? Yes. Ma'am, you are muted. You are muted, ma'am.
Firstly, hi everyone. I highly congratulate Dr. Prerna and Dr. Madan for organizing such a wonderful webinar and a very special topic of this. And now we are having a speaker, Dr. Venu Gupta. She is postgraduate diploma in medical legal science from Symbiosis, Pune, and the research experience of 23 years with the teaching experience 11 years. Served AOGS for more than 10 years. She is joint organizing secretary UPCon 2006 and 2018. The life member of the UPCOG and ISOPERB. Now we are all ready to listen your wonderful talk and keenly waiting for that.
Thank you, ma'am. Good evening, everybody. I would like to congratulate and thank the organizing committee for giving me this opportunity to talk on a very burning topic and the need of today, that is the impact of social media on adolescents' health and sexuality. Every day we read a newspaper and there is a news. Yesterday only there was a news, teens, adolescents girls ने suicide किया. Why? The reason was they were very much addicted to the social media और उनके father ने उनको prevent किया रुकने से. The day before yesterday, I heard a news that a boy of 22 years, he was a son of a very renowned pediatrician in Allahabad. He ended his life by hanging. The cause that he lost so much of money in the gaming in the social media. So before going into the details of the impact, we should know what is adolescence. What is this age? The adolescence is one of the stages of the human growth. The WHO defines adolescents or teenagers as people in the range of 10 to 19 years. Younger people aged 10 to 14 years are defined as being early adolescents, and those in 15 to 19 as they're in their late adolescence. What happens to this age? It is a transitional phase of growth and development between the childhood and adulthood. So this stage is a stage of physical and psychological development that generally occurs during the period from puberty to legal adulthood. तो क्या चेंजेस होते हैं? What changes occur in a person from puberty to adolescence, from childhood to adolescence? There can be physical changes like changes in skeletal structure, muscle and brain development, hormonal and sexual development. Like in girls, they start their menstruation, the breast they develop. In males, there is hoarseness of voice, or there can be development of mustaches or a beard. Then there can be changes socialization. Begin to socialize more with peers and separate themselves for family. बच्चों को लगता है कि अब वो बड़े हो गए है ना. That is actually they are not that mature, but they feel like, so they feel separated from their family and they want to be with their peer group. अपने एज ग्रुप के साथ वो socialize करना चाहते हैं. Then there can be cognitive development, experience higher thinking, reasoning and abstract thought. personal and emotional characteristics, emotions begin to run high. There is development of argumentative and aggressive behaviors. कभी आप इस एज के बच्चों को कुछ कहिए, एकदम से aggressive हो जाते हैं. So this is because of the changes which occur in their body or in their emotions. So we can see what are the problems. The common problems in adolescence can be physical changes, behavioral changes, addiction to cyberspace, emotional changes, psychological problems, educational challenges. लाइक अब वो बच्चे उस समय 9th-10th में हैं, 7th-8th में हैं, तो एजुकेशनल पढ़ाई का स्ट्रेस रहता है, अपने करियर का स्ट्रेस रहता है. देन देयर कैन बी हेल्थ प्रॉब्लम्स, पीरियड शुरू हो गए हैं तो उस तरह की प्रॉब्लम है, या then there can be drug and substance abuse, social problems like dating and relationships, aggressive and violence, stress, bullying, depression, anxiety, unwanted pregnancies, as Dr. Tamkeen has already stressed upon, peer pressure, and there can be misinformation. These are the common problems which we see in our adolescence age. Now, what is the social media and how does it influence to the adolescent? The social media are the interactive technologies that facilitate the creation and sharing of information, ideas, and interest through virtual communities and network like Instagram, YouTube, Facebook, Pinterest, Snapchat, etc. And the influence is a marketing term that describes an individual's ability to affect other people's thinking in a social online community. So how does it influence? The growth of technology has changed and the world had also changed, and it has changed the daily lives of children and adolescents. They are more busy with social media. Many adolescents, they use internet, cell phones, television, and computer video games on a daily basis. Through social media networks, they can create new friendship, express their views and opinions, and even create new identities. Increased use of technology may cause decrease in amount of sleep, increase in behavioral problems, and attention difficulties and poorer academic achievement because they are always busy in social media. They're always busy in mobiles. Now, apart from the negative impact, there can be benefits of social media. And what are they? There can be enhanced learning opportunities, like it has widened the use of online learning. आजकल तो ऑनलाइन क्लासेस भी होते, छोटे छोटे बच्चे भी ऑनलाइन क्लासेस ज्वाइन करते हैं. Students, they discuss among themselves about their home assignments and projects. Project works through social media. Students can depend on internet to know more about different subjects and lessons. It helps in skill developing. It helps students and teachers to share idea among themselves. If there is any topic, if anyone wants to have some information about any subject, they can just Google it out and they get the information. So it becomes very easy. Then socialization and communication, it develops friendship with mutual respect and tolerance. They can improve their creativity. Adolescents develop attitude among themselves, society, and events taking place around them. Apart from that, they also get detailed information about health issues, infectious disease, which reduces their mental stress. Like suppose कुछ patient किसी को कुछ होगा, they just Google, they get the information and they are relieved. Sometimes the misinformation, they also causes more of the mental stress. So the signs of social media addiction can be spending an excessive amount of time thinking obsessively about social media, even when not using it. अरे आज हमने WhatsApp नहीं देखा, आज हमने Facebook नहीं देखा, तो वो उस तरह की thinking develop हो जाती है. Withdrawal from other activities, like they don't want to spend their times with family, or they don't want to spend their times in their hobbies. They just, the whole time they are on the social media, they are watching WhatsApp, Facebook, then Instagram, obsessing over online image and reputation, feeling anxious when one cannot check the social media, and obsessing over social media interactions. Now coming to the negative impacts, mental health challenges. In a study which was done in USA in 2013 to 14, they did a study at in the children, teens of 12 to 15 years old. And they said that being on social media for 3 hours, for more than 3 hours, was linked to the mental health problem. In another study, which was done in UK, which was done on 12,000 teens between the ages of 13 to 16 years, they found that if the social media is used for more than 3 days a day, that is linked to mental health illness. Then there can be cyberbullying and harassment, addiction and screen time, privacy. Of course, the privacy sometimes is not maintained. Every time if somebody goes anywhere, they just put the pictures on the Facebook, and the other people, they come to know where she's the look about the location, and that hampers the privacy. The impact of academic performance, क्योंकि सारा time तो social media पे they don't study at all, and of course they don't read the subject. Even in a PG program, कुछ भी आप दीजिए तो they just search the Google. They don't want to read the concept of that thing. We were used to read the books, but now the students, they don't read the books. Body image and self-esteem issues, and online misinformation and the fake news. Now the impact of social media on sexuality. The positive impacts are that improved sexual awareness and education due to increased access to information related to sexual health, contraception, consent, sexually transmitted infections, and reproductive rights. Identity exploration acceptance. It provides a safe space for individuals to explore and express their sexual orientation and gender identity. Other communities, they help reduce feelings of isolation and promotion self-acceptance, especially among LGBTQ plus individuals, means lesbians, gay, bisexuals, transgenders, and those type of individuals. Reduction of stigma and taboos. The topics which were previously considered as taboo, like talking about menstruation, talking about infertility, talking about dysfunction, and mental health related to sexuality, are now being openly discussed. Support networks and poor connectivity. Individuals will connect through online forums and support groups, fostering empathy, validation, and emotional support. Then unrealistic body image and sexual expectations. Exposure to highly edited and idealized images promotes unrealistic standards of physical appearance and sexual performance. Over sexualization and pornification. Frequent exposure to explicit or suggestive content may distort perceptions of healthy sexual relationship. Sexuality may be viewed as performative rather than intimate, affecting emotional bonding. Impact on adolescence and early sexualization. Children and adolescents are exposed to sexual content at an early age, often without adequate guidance. जो वो देखते हैं उनको लगता है वही सही है. There's nobody to tell them because they are seeing the pictures and all on the Facebook, and there is nobody to guide them. This may result in confusion, risky behaviors, and psychological distress. Consent, privacy, and ethical concerns. Issues such as cyber harassment, sexting pressure, non-consensual sharing of intimate images, and digital exploitation raise serious ethical and legal concerns. Then there can be effect on relationships and intimacy. Excessive social media may reduce face-to-face communication. We don't communicate. सब कुछ messages पे हो रहा है, सब कुछ Instagram पे messages हो गए हैं. तो you don't communicate face-to-face. That will impair the emotional intimacy and contribute to relationship dissatisfaction. The abundance of online options may also lead to concomitant issues. Now, this is the bar diagram which shows how many percentage of people they use social media. They chatting with friends, 94.4%. Chat with strangers, कुछ नहीं पता किससे chat कर रहे हैं, but they are going on chatting. 73.8%. Posting and viewing pictures, 68.7%. Update myself, 47.7%. Watching videos, 29.7%. Viewing nude pictures, that is the most important part, 21.5%. Watch nude videos, 19.9%. Search for sexual partners, 17.8%. So these percentage is going to affect the sexual health of the teenage. Now, considering the negative impact, although we have many positive impacts also, but if the things are going in the right direction, if they are watched. So what is the role of parent, the educators and the health professionals? Promoting digital literacy and responsible social media use, providing age-appropriate sexual education, encouraging open communication and critical thinking, and addressing sexual health concerns without stigma. As a parent, what we can do? We can set the timings. जैसे कि बच्चों को वी कैन से कि होमवर्क कर लो उसके बाद देखना है, या सिर्फ 1 घंटे आपको सोशल मीडिया पे रहना, तो वी कैन जस्ट लिमिट द टाइम एंड वी कैन जस्ट लिमिट द नीड. And if you see any change in the behavior of the teens, if you see any change in your child behavior, just go through and see what wrong has happened to him. Then turn on private settings, monitor your teen's account, be as a role model, encourage face-to-face communication, and explore and explain to the children what not to be done. So to conclude, adolescence is the span of years during which boys and girls, they move from childhood to adulthood. So there can be changes mentally, emotionally, socially, and physically. It's the period of development from onset of puberty to the age of maturity. So it is a period of transition. Adolescents become intensely emotional, self-consciousness, too much developed, peer group relationships are too much intense. There are several problems faced by the children during adolescence period, and because of the misinformation, there is nobody to guide. पहले तो अपने पेरेंट्स से पूछते थे, आजकल तो सिर्फ सोशल मीडिया पे जाके दे गेट द इंफॉर्मेशन, दैट इंफॉर्मेशन मे बी रॉन्ग. सेकेंडली, छोटे छोटे बच्चे भी टीवी देखते हुए ही खाना खाते हैं, दैट लीड्स टू ओबेसिटी, दैट लीड्स टू लैक ऑफ कंसंट्रेशन. So the social media has a great influence on children in the adolescence period through television, mobile phone, internet, etc. So social media has several positive influences also. It helps in skill developing, helps to share ideas, get more information regarding different subjects and health problems. But the negative influences of media on adolescents are also very important. The continuous and uncontrolled use of television, internet, and mobile phone may cause several health issues, especially the mental issues, especially the obesity. And because of obesity, many of the problems like PCOD, like in later stage, there can be hypertension and all. Excessive use of social media may cause drowsiness, disturb sleep. 12 बजे तक, 1 बजे तक they are all watching social media. सुबह देर से उठना है, they all affect their health. Internet addiction had adverse effect on long-term memory, critical thinking. अपने से कुछ नहीं think करना है, जो दिखा है उसी को करना है. Creativity, span of attention, deterioration of mental health. Because of the influence of social media, adolescents may get involved in cybercrime also. Therefore, while using social media, the students must be careful. Thank you so much.
Dr. Madan.
Excellent presentation by Dr. Veena Gupta. She has been my teacher in Allahabad when I did my PG. And I would like to say, it is said that the child is the father of a nation. Actually, the children, especially the girl child, is the mother of the nation. So we have to be protective. Like so many diseases are there which require in utero programming as well. So after the children are born, it is our responsibility to take care of them. We have to live with social media. We have to be more protective about children, and we have to be more friendly with the children. And we have to maintain the relations with their peer groups as well, so as to prevent certain diseases. So it is very important.
Both the parents are working now, so the children, they are wasting much time in social media. So it's our duty as to give time to your children, and then you should have to face interaction. आजकल तो सब कमरों में बैठे हैं, WhatsApp पे messages पे ही
What
सारा
they are living
बातचीत हो रहा
these
है.
days in a virtual world, and we have to bring them out of the virtual world.
Yes.
We have to be, we balance both the things, social media plus this social group also, real social group, which should be followed at home as well, because the parents are the role model. What parents do, children always imitate. So it is our responsibility, equally our responsibility.
Veena,
Thank you, ma'am.
Thank you, Dr. Veena. This was really wonderful discussion, and you explained everything in very simple way. Actually, what I think, of course, this is a burning problem of the adolescent, but social media शायद हम लोगों के लिए भी इतना ही नुकसानदायक है.
Yes, of course.
Yeah.
Yeah,
What
but
we do, children will follow. We have to
all the
curtail
problems
ourselves
I
also.
think we
Our
all
screen
are
time,
facing. We
screen
all
time
are
should always
facing.
be
Yeah. But
We
curtailed.
don't interact
of
with each
course,
other face to face.
adolescent, they are the
Even on the dining
future.
table, everybody is
Yeah.
with the mobile.
Actually,
Yes, yes.
Nobody is
But
talking.
yeah, anyways, this was a very nice uh, topic to be discussed, and you explained everything in very good manner. Thank you.
I think
Thank you
much
so
will be
much.
discussed in panel discussion also. So I made it
Yeah.
short.
Yes,
We have Rao
Thank
sir
you,
Thank
also
Dr.
you
with
so much.
Veena.
us. TSS Rao sir,
Yes,
please.
yes, Veena ma'am, it was wonderful presentation. You have covered everything. Actually, topic itself is a great. Actually,
Yeah.
Rao sir.
we request Dr. TSS Rao sir to
Hello.
comment. Yes, sir. Please welcome.
Thank you.
We need your comment on
Rao
this.
sir. Rao sir, please comment on teenage pregnancy as well.
Of course, it was very well covered. The important thing what we have seen is actually the social media and other related things have brought some amount of adventurism in young, and most probably unable to understand the difference between real and real. In fact, this
Yes.
is what actually leads to. However
Mm.
careful and however educated and however sensitive about this issue, those moments of weakness automatically, in fact, leads to quite a bit of difficulty. In fact, some of the cases what we have encountered and referred to the gynecologists, this appears to be, in fact, this problem is there for a long time, but now we realize it has become more free and has led to a lot of changes because of the social changes. One is
Yeah,
the
yeah.
mobility that has come up.
The exponential
Uh,
growth.
you see, when I talk about sexual revolutions, earlier we used to talk about OCP and many other such these things. Now the scooty and the mobile, these two things are highly problematic things which has led to a lot of things. In fact, we can call another form of sexual revolution that is actually has seeped into. Good.
So you have very
And
well
plus,
said.
few
There is a
countries are
big
banning
difference between the
also
real and
mobile
real.
for children.
Mhm.
Few countries have started banning, like Australia and other
Yes,
places.
yes.
Yeah,
Sometimes
Australia, I
children
think
will
they have.
up to 16 years.
Australia
It
has
should
banned, I
go.
think, and the France
Yeah,
is
yeah.
Australia has
going to.
banned.
Australia,
Yes.
France is
they
going
have
to
a
ban.
rule that
France
till
is
18
planning to
years,
ban till
Yeah,
16 years of age.
and
actually, it should
European
be
they
banned
have
for the
16
teens.
years.
Yes, yes.
Asha ma'am, patron Harvard Society, ma'am, your inputs, please.
No, this is the topic of national interest rather. Huh? It's such a important and hot topic that where our adolescent people are going, because these are the further future generations. We will not correct this generation. How can we save the future of India? So this is
Yes.
a very, very important topic, and it is taken up so well by Dr. Veena Gupta. Thank you so much. Very good
Thank you, ma'am.
presentation.
Thank you, ma'am.
Good presentation, ma'am. Excellent.
Thank you.
Thank
Dr.
you so
Madan.
much. Yes. Ms. Prerna, we will move to panel discussion now.
Yes. So we thank all our chairpersons and speaker of the previous session, and we are extremely honored to have you all amongst us for such a wonderful session and such an insightful purview on the important, very pertinent topics of teenage pregnancy as well as impact of social media on adolescent health and sexuality. Moving forward, we have a panel discussion with a string of stalwarts with us. That panel discussion is on psychosexual issues in adolescents. Some was extrapolating what we have already discussed in the first hour of this webinar today. So with me, I have my co-moderator, Dr. Madan Kamble, who is the pioneer in FOXY Sexual Health and STI Committee, has been doing a lot of work with over the years now, and the chairperson of AMOGS Sexual Medicine Committee. We have our experts, Dr. Asha Mishra, ma'am, patron of the Hapur Society. Ma'am is a very, very revered member of Hapur Society, and Dr. Sambul, ma'am, she is the secretary of Aligarh Society. We have a string of esteemed panelists, Dr. Ratna Bishwas ma'am, who has sent her apologies for not being able to join in because of some family emergency. Dr. Archana Mase ma'am is here with us, Secretary Ajamgarh Society, Dr. Amrita Chaurasia ma'am, Secretary Allahabad Society, Dr. Indu Singh ma'am, Secretary Bulandsahar Society, Dr. Seema Pandey ma'am. Seema Pandey ma'am is quite busy. She has almost 20 laparoscopies today, but has said that she'll try to log in. Dr. Uma Sharma ma'am, past president of Hapu Society. Dr. Richa Singh, a very, very beloved gynecologist from Agra and a very wonderful friend of mine. Thank you, Dr. Richa, for being there from the very first day. The first CV that we received was yours. So we are really honored. And you are always loving. And Agra is like a second home now for me. And really always glad to see you offline, online. And Dr. Renu Bansal, we have Secretary Hapur Society. So with this, we start our panel discussion without much ado. And
we request other faculties also, they can contribute to the session anytime.
Yes, ma'am. And all our and both our experts, Dr. Asha ma'am and Dr. Sambul ma'am, to please guide us through the panel. I'll share my screen right away. Is this visible?
Yes.
Let me first acknowledge that this particular presentation was made by Dr. Madan Kamble, and I have just the honors to share it with you on screen. And so we have a string of experts and panelists with us who will be guiding us through this wonderful panel. And as Dr. Veena Gupta has already transcribed what is adolescence, is a transitional stage of physical and mental development that occurs between childhood and adulthood, that is 10 to 19 years of age. And influencing factors for adolescent sexuality include gender identity, sexual orientation, the culture you live in, and how your body develops. So adolescent sexuality is something which is an individual's thought, a perception, as well as response, which gets colored sexually. Now, puberty is an important landmark of sexual development that occurs in the adolescence, and the myriad of changes that occurs in adolescence puts them under enormous stress, which may have adverse physical as well as psychological consequences. Understanding adolescent sexuality has important clinical, legal, social, cultural, as well as educational implications. And this is something which is a graphical approach towards adolescent sexuality, where we have interrelationships, domains of development, complex dynamic evaluations, and much more. The psychological development in adolescence, they have the biological changes where the puberty, hormonal effects, and secondary sexual characters, they come into play. The psychological and social changes affecting sexuality are cognitive changes, emotional and social changes, as well as behavioral changes. Many of these have been discussed by previous speaker in much detail. And the common psychosexual issues that occurs in adolescence arise right from sexual orientation and identity conflicts, as well as psychological factors like stress, anxiety, guilt, depression, trauma, and a lot of other issues like premature ejaculation, erectile dysfunction, delayed orgasm, and a loss of sexual desire or pleasure, with myths and misconceptions surrounding around sex and pornography. So the menstrual problems for a girl also comes with this, with a lot of we have discussed about teenage marriage, then unprotected sex, sexually transmitted infections, and a lot of unsafe abortions, and they're ranging from addictive behaviors to depression and suicide as well. So what we are focusing is on identity crisis and teenage pregnancy. We have discussed in detail, and STIs as well. So Dr. Madan, you can take this first case. Dr. Madan.
और मैं मोटिवेटेड अगली
Dr. Madan, are you there?
मैं गुरुवार की रेडी में 5 बजे आ थी पर ठंडिया को चीज खा लेती जब ऑपरेशन हुआ है
Dr. Madan.
मार्च में हुआ था तो मैं
Yeah, I'll take this first case. Anybody from our esteemed panel can take this up. This is we have one scenario where you are entering into your 16-year-old son room and you found that your son is masturbating. So what do you do next? Whether you counsel him, you take him into confidence, or you scold him, or you just move around. So anybody, we can start from our panelist, Dr. Richa. You can take this up.
Well, at this age, this phenomena is not very unusual. So, as a parent, one should understand that at this age, there is a lot of things which are experimental for adolescents. So, very frequently, adolescent boys do masturbation for pleasure or for seeking, for in quest of how it feels. So this is something which should not be scolded about, but yes, they should be taken into confidence that this is a natural phenomena which needs to be done in privacy and maintaining the hygiene. Uh, and it and it will not hamper the future fertility.
Very well taken, Dr. Richa. Our expert, Dr. Asha Misra ma'am, or Sambul ma'am, please add on to this.
Yes, this is a physiological phenomenon. So the child, the yes. Somebody has
Can we
to be
have others
muted.
muted, please? Dr. Asha Misra is speaking.
So this is yes, this is almost a physiological phenomenon. It happens. So the children has to be very tenderly spoken, taken into the confidence that this is normal. There's nothing going to be wrong with us. It happens with many children. It's not going to have any other problem later in life. Could be physical, maybe infertility, maybe psychosexual problems. So gradually these things goes off. These things doesn't persist. So they have to be counseled. They have to be taken into the confidence. They have to be assured that they will have be fine. It's not very abnormal for them to have.
Yeah, true. There are so many myths about masturbation that this will lead to infertility and infections and so many things. So you have to tell that boy that, okay, this is physiological. It's not something new with you. It happens, and you should not feel bad about it.
Thank you, ma'am. Would any other panelist would like to add something to it? Dr. Sambul ma'am, our expert.
Yeah, I just told.
Yes,
I
yes. Okay.
gave my
Yeah. Okay. Dr. Madan, you can take this ahead from here.
Yeah. Yeah. Next slide. Next. Yeah.
Is this not moving?
No, it's not moving. Yes. Let us know about the sexuality education. Everyone knows what is sexuality education, and doing all the job. Every gynecologist do this job. Let us know what is right, what is wrong, how should we go ahead. Should the sex education be a part of the school education, and what is the right or appropriate age from which it should be started? Uh, any panelist can take this question. And again, who is the right person to teach this subject? Yeah. Yeah. Anyone can take this question.
Dr. Indu ma'am, Dr. Renu ma'am, Dr. Amrita ma'am, Uma ma'am. Anybody who is there, please.
This subject can be taken up by a school teacher, by by parents, by anyone elder in the family, and the thing is that how should the subject begin with the child and at what age? So I think the age should be when somewhat before when the puberty is about to start. So I think 8 to 10 years, at least 8 to 10 years of age, when the child is mature enough to understand, and when the physiology, with the beginning of the secondary sexual organ development, because then they have to relate with them also. They are feeling odd because of their these physiological changes which are occurring physically. So, sex education should be started around 8 to 10 years of age. They understand the anatomical changes better, the menstruation, which will be about to begin in girls, about the hair development at different places, about their privacy. The just as we tell the small children good touch and bad touch, so these have to be told about these at 10 years, they have to be told about their consent and privacy. So, but at times, the parents and children may not have the level of communication to this extent. So, the teachers fit in better. But there are problems also. It is not so easy to give sex education in schools because in co-education, when the teacher is telling and it's the girls and boys are there seated there at 10 to 12 years, how will they accept this sex education, or should they be told separately? The girls and boys should have separate sex education classes. That needs to be discussed.
To add on to this, Dr. Richa, Dr. Madan, just maybe 2 days back, we under the Young Talent Promotion Committee, we are doing a Prayas program, that is a sex education for the adolescent females and males in schools. And just day before yesterday, I went to one school and we had included class 7, 8, 9, 10, and 11 students. And ma'am, Asha ma'am, you will be surprised to see the chits. We had invited anonymous chits on the behalf of the students so that we can answer those questions. We got almost 50 chits, and these were from class 7th standard students. And the chits were, they were saying, how is it is okay to become intimate with our partner at the age of 14? Is it okay to break our virginity at the age of 14? They were all questions revolving around the age of 14, and they were all revolving around intimacy and sexuality and breaking of virginity. And like, if you see that those chats, your brain will go haywire. That's, we had to answer because we had this foxy this input that we are going for a sex education for these particular students. But then this was really something that had blown up our minds, that these people, what are they thinking? That I just had to quote Foxo at times because this is not right. You have to be 18. Like it's
Horrible
pretty too
situation
much.
is there. Horrible
Horrible.
situation. We are
Every
thinking
chit
of
had this.
Actually,
Every
the
chit had this.
puberty has a big range, and the puberty is coming early in India nowadays because of the many, many factors that already been told by Dr. Veena. Huh?
we are
So,
still thinking whether to talk or
Ma'am,
not to talk.
ma'am, the Rotary International had asked us, the doctors here, the RI 3240 had asked to go and teach them about good touch and bad touch. Then when we saw the chits, we said it is beyond good touch and bad touch. You cannot tell these particular students good touch, bad touch. It's beyond that. They are into some different strata of living now.
So actually, as the phase of the adolescence, it is the middle part of the adolescence that's more tender, and all the mishaps and all the problems comes in this very age because they are not judgmental. They cannot judge. So after 18, this problem doesn't come. So 10 to 14 years of the age is rather a difficult age. Rather, 14 to 18 is also equally difficult. But as the puberty is coming early, we have to think that we have to start giving sex education and health education in their 8 years onwards. At
Problem is
least
that
in class 6,
yeah,
5.
they are learning from social media. They
Yes.
are learning from social media
So,
and
poor thing is we do not
not.
have any rules in our country that what are the children, at what age they can access social media. Like in America, they cannot access. Australia, they cannot access social media till 18 years. European countries, they have 16 years of age. India, everybody can access anytime, anywhere. Parents also, they do not know. They feel, okay, well, he knows how to use a tablet and mobile. It's a status symbol. And
Yeah,
that's causing the problem.
that is the sad part in India. There will not be any restriction, I think. That will
So,
take this
whenever
situation more.
any mobile or tab is issued to or a smartwatch is given to these ones, they should be, these social media sites should be blocked on their mobiles. Like I have a grants 14 years, 15 years. Their smartwatch, they have only limited internet available. They have limited phone calls that they can take up. So we do not, and we should have a rules regulation in our country that we cannot ban, but of course we can limit the social media for till certain very age. Like ड्राइविंग हम 18 साल के बाद क्यों करते हैं, तो क्या इसी तरह ये भी नहीं कर सकते?
Yeah. Yes, yes.
Dr.
Great,
Madan, you
great.
can
And
take
it
up the
is the
scenarios
sexual
again, sir.
committee to take
Yeah.
these issues ahead
Both
with
Yes,
of
the
ma'am. Yeah,
with
we have to do, and we are trying at our best. But just hearing from Prerna, just we are literally shocked.
it's shocking.
shocked. I was shocked even.
Yes, very difficult
I went
situation.
two years back, ma'am, to the same school. And
Mm.
2 years back, the scenario was like a girl of class 6th or 7th standard getting up and saying, how about kissing my boyfriend? This
Mm.
was the question. And this
Mm.
was one out of maybe 50 students. No, not many students have asked, just one or two. How about kissing? Now, this kissing has gone in 2 years, it has gone to intimacy and losing virginity. I was like, too much. Dr. Madan, you can take the second scenario.
Yes. So, second scenario. She's a 19-year adolescent girl who is unmarried, and she has come for the consultation. She is in a steady relationship with her boyfriend, and she wants to take the things to the next level. And she is demanding contraceptive advice. She has specially come to you for the contraceptive advice. Then how will you guide her? She is unmarried, and how will you guide her? Yes. Yeah, we routinely are doing in this OPD. Just anyone can take this question. Just share your practical experiences.
Well, at least she's aware that she needs contraception, and she also, with this contraceptive advice, she has to be given additional advice about STDs also. So,
Yes, yes.
we have to offer her the choices. She can go for barrier contraception, and which in addition will help us help her against STDs also. And the second choice is oral contraceptive pills, which are good for her at this age. But if now it depends upon the frequency at which she's having this intimacy with her boyfriend, whether she might like it's once a while phenomena, then she can even be told about emergency contraception, but in on barrier. But if it's a regular phenomena, then it's better that she takes COCs.
Yes, that is why we have to take the detailed history, and counseling part plays a very important role. And depending upon that situation, we can advise the type of contraception. Yes, right. Suppose she is the daughter of your best friend. What you will do as a doctor? Suppose she is a daughter of your best friend. What will be your take? Yeah. Anyone can take this question.
Uh,
We-
You have to be very sympathetic. First, take her into the confidence so she
Yeah.
can just tell. Is she habitual? It is casual. The type of intercourse she's having, and all sort of histories. One partner, more partner, and then she should be explained the risk of sexually transmitted disease. Even if she wants a contraception for the pregnancy, she requires additional protection for the STD. That
Yeah.
has to be
Yeah.
explained.
Will you ask her to stop this nonsense things?
So
We
even
can't,
if you
we
ask,
can't,
she will not.
uh,
Huh?
we will not
we
do
have
that. We
But
should
you have to
tell her
say
the
what is
right,
right, what is
wrong.
because
no,
Yes.
wrong.
now they
No,
don't
it is
need
for her.
emotional attachment. They are doing it for physical pleasure. So no use telling them to go for abstinence.
Yes.
They will
You have
if
to.
she has decided, she will go ahead for
You have to put such certain examples. So
One,
what information they gather, what lesson they get, it is up to them.
but one thing we have to follow the rule of privacy and confidentiality.
That's true.
In spite of knowing that she is a daughter of your friend, she has come to your
Yeah.
OPD.
That is a part of
Uh,
professional ethics. That
uh,
will.
Practically what we do. Practically what we do. But we have to follow this thing because generation is much ahead of us, and we have to follow this rule because they have their freedom. But at the same time, as you have rightly said, we have to counsel and advice regarding the safe sexual practices. Yeah. Yes. The next scenario is a 20-year-old female student comes in your clinic. She recently had unprotected intercourse with a new partner, and she has previous two partners also in the past. At present, she is asymptomatic, but she is little bit worried about the contracting any infection, and that's why she has come to you and asking for any test available for knowing whether she has any risk of STI, वगैरह. So, how will be your approach to this case, and how will
Sambul
you
ma'am
manage?
has not. Sambul ma'am, please.
Yeah, we should tell her about cervical screening, and if she is not vaccinated, she has to be vaccinated, and other STDs also. And we should tell her to use some barrier methods so that she can be protected from STDs. I think this is to be done.
Yeah. Okay, we have to counsel such patient as you have rightly said. We have to tell this importance of STI prevention, methods of STI prevention, any HPV vaccines, whether she has taken or not. We have to give information about that also. And if she is have us, if she would have been having symptoms, then we can explain her regarding the. We can ask her regarding if any symptoms and treat accordingly. And at the
Yes.
same time, we can counsel the partner also as a couple also. Next slide.
Dr. Richa ma'am, Dr. Asha ma'am.
It's the same. We have to counsel.
Yeah.
We have to take her into confidence. We'll have to tell her the safe sexual practice. And of course, investigate if some problem is there and treat accordingly.
And she wants some test, then we can advise the test, routine test accordingly for any sexually transmitted infections or HIV or this thing, VDRL.
HCV also
That
is
we
pretty,
have.
HBsAg is pretty common nowadays.
Yes, that we have to advise. She wants, if she want to undergo
So
some
she
test.
should be thoroughly investigated for
Yes.
STDs.
And if
And
symptomatic.
just
Chlamydias.
recently,
Both the
Dr. Richa,
partners
you
should
have
be
any input on
investigated.
this?
Yeah, both the partners.
Dr. Richa, any
I
input on
think
this?
Yeah, anyone, is
What
there
about the
Veena?
previous partners? How do you know that she is carrying something from them?
and then about like which route or are they following? Because
Yeah,
nowadays
everything.
oral route is also prevalent in adolescents.
Yeah,
So we should
yes.
ask which route they following. So that also has to be taken into account.
Yeah, during the history, we have to ask these details, types of intercourse they are having. And yes, next slide, Prerna.
It's not moving actually. There
What
was this
happened?
patient of, it's not moving somehow. There was this patient of mine, Dr. Asha ma'am. Her father came and he said that my daughter is going to Australia and she'll be staying there with her boyfriend. She's 16 and please prescribe her contraceptives. The father came with the daughter and he was asking the same. So such like I was really astonished at the broad-mindedness of the father. And it was really taken. And then he took a pack of OC pills almost for 6 months at a
See, we
stretch.
do not know how long she'll be living in the Australia. So
Dr. Madan,
best
if you
thing
can
will be
share, this is
Lark.
not moving from
Like
my end.
1
I don't
year,
know
2
what's.
year to complete the
Okay.
graduation, whatever she is going to do, along with the barrier methods. That will be the best.
Yes.
I think
Long acting.
like her father is very intelligent and he knows the what bad can happen
I'll stop
to.
sharing, huh?
Yes, yes.
So I think long acting contraceptives, or they could be, when the best will be, even IUDs are good for these, along with the condoms. And then we can, of course, give the implants. Implants are in fashion nowadays.
Yeah, is it visible?
Yes, yes, you can take this.
Okay. Yes, a 17-year-old female student comes to you and explains that she has recently been attracted to her best friend, who is also female. She feels afraid to accept this, as all her other friends are attracted to the people of opposite gender. Then she thinks that she will be ostracized by her peers and the society. She is in confusion. Then how will you manage this case? How will you counsel her? She is 17 years. Because counseling part is very important in this case. Yes, anyone can take. Is there Veena ma'am also, or has she left?
Now, after that Section 377 change, uh, people have they are forced now, I should say, even those who were rigid, now we have changed our thinking for this homosexuality. And with this change in scenario, this young generation is now more opened up, more bold, and now we are seeing more and more homosexual relationships. Initially they were hidden in the past years, and they were fewer also, but now they are open. And once they are open, more and more people are going for such homosexual relationships, with what I feel. So I now this is, we cannot be judgmental. Just like at 14 years they are asking about intimacy, so this is the change which has occurred. Good hai, bad hai, pata nahi, this law, the change in the law, but accept, we have to accept it with this coming generation.
Yes, these people are in a lot of confusion as far as their sexual orientation is concerned. Uh, that is why in these cases, actually, we have to counsel them regarding that what you are thinking is not an abnormal. And there are some support groups also. And also at the same time, we should appreciate her openness, and that she is doing right thing, that she is coming out, she is expressing herself, or uh, and accordingly we can guide her, and not to worry. There are so many support groups are there, and if there are any problems, physical problems or sexual problems, we can deal with accordingly.
Even
We have
Supreme
Hindu
Court, I
ma'am
think,
also.
has accepted all these things. There was a verdict of Supreme Court
Yes,
law.
yes. Yeah, we will come to that. Uh, yeah, what is 377? Actually, initially it was against the order of nature, but
Mhm.
in 2018, the Supreme Court has ruled that application of Section 377 to consensual homosexual sex between the adults was unconstitutional, irrational, and indefensible. But it will remain in force in the relations with sex with minors and non-consensual sexual acts. But
So
still, the
these
marriage is
come
not
in
allowed.
minors, no?
It is not removed in the sex with minors or in acts of non-consensual.
Mhm.
Yeah,
So
but
the
still, they
Supreme Court
cannot marry.
accepted this.
Yeah,
Oh,
they cannot
sorry.
marry.
Yeah, they cannot marry, and
They cannot
if
marry.
maybe the thinking is changed in the society, but they will not survive in our society. So, like, they need support group and better environment for their relationships. They should move to the better environment, I
But
think. Actually,
now people.
homosexuality is not it's not in this era. It is from old era also, but the people were not talking about it. Now the people are talking about it. It is partially accepted, but
Yes, people.
still this is
Yeah,
something
people are
not
coming out and living
openly.
together also.
Yeah.
Is there TSS Rao sir? Rao sir, are you there? Rao sir?
Sir is here.
Okay. We want comment from sir.
Ah,
Sir, please
the,
comment. Please comment on this issue.
the issue was homosexuality, no?
Yes.
Sir, yes. About 377. What is the current scenario?
See, earlier, okay, 1 minute. Just a minute. See, earlier it was actually what Supreme Court gave the evidence, then it was actually modified. And the third gender accept. Are you able to hear me?
Yes,
Yes,
sir.
sir, very much.
Okay, okay. The third gender and actually the adequate protection for that are already been there. Now the only question of issue is actually, in fact, the permission for the marriage and adopting the children. These are the only two issues which are actually pending. Otherwise, for all reasonable expectation, we are there with many of the Western data that is actually available, rules and regulations.
Okay. Yes.
We have
Thank
Indu ma'am also with us. Indu ma'am are one of our
Yes.
panelists. Indu ma'am, are you there? No. We
Okay.
can move
Yeah.
on to scenario.
Yeah. You can take up Prerna.
With extrapolating our panel discussion from what is homosexuality by a very revered rouser, and we'll move on to this particular scenario where the school authorities report that some students of Standard 9 who have been caught watching porn. So this is a very common scenario nowadays, and you are asked to address the students about the same. Now, how do you go about it? What is your opinion about concerned student, whether they should be punished, whether they should be explained, whether they should be counseled, or they should be stringent actions against them? So anyone? Asha ma'am, Richa ma'am?
It's a very delicate issue. It's expression. It's a very sensitive issue. Of course, they have to be told that it's not right thing.
Yes,
But
ma'am.
they have to be taken into the confidence. What are the implications of doing this? What is the later on effects in their life? Maybe their family will not accept it. So all these things have to be discussed.
Yes, ma'am. What we
After
need
they
to
get
tell,
married, they will have problem. And those
ma'am,
parents may not be liking all this.
very well taken, ma'am. And the very, very important thing is that there's a very small and a very thin line between internet pornography addiction as well as gathering of information. So this may have serious implications on the societal structures as well as they might be deviant and end up into having illegal implications to it. So these are the particular strata and these are the index online activities where we show that the clearing of browser history is around 53% by these teenagers and using of private browsing modes around 20% and two creating duplicate fake and sexual network files that is around more than 10% happening in adolescent period. So we need to be very, very vigilant about it. So, Dr. Richa, can you take this up? What are the social and behavioral implications related to pornography as well as these particular teenagers getting used to using these sites on internet?
Well, pornography naturally at this age is very addictive and attractive for these boys. And the only way this has to be curbed because they have to be counseled that this because this can affect their mental makeup, their behavior with the other sex, and even they can go for risky sexual behaviors and misbehave with the other sex. So the restriction has to be there at home, in schools, for them to access these sites. And porn is definitely a no-no for a teenage boy.
I think they have to be explained that if we go this, they'll be more addictive. They'll not be good in their studies. Will not be able to pursue any career. And their future life will be adversely affected. So I think if you explain that way, maybe they somehow, that if they are not able to learn well, they are not able to work well in their studies, so they may be counseled to certain limits.
Yes, ma'am. So the challenges can be coercion, sex texting, sexual abuses, and misconceptions about sex and drug addiction. These are few things that we need to always keep into minds when we are dealing with psychosexual issues in adolescents and how to address them. Can we have the other slide? So this is something where we need to stratify on the importance of education as well as open and respectful communication. The motive of putting with this slide was that the school authorities had asked the experts to come and comment on it. So what we can, in that particular scenario, what we can do is that we can say that we are here for proper sex education. Just approach us whenever it is required. We are there to give the sex education to the kids. Do not ask them to go through these pornography sites to understand about what's the sex and sexuality. So this was our idea of putting the slide. So we need to have the role of parents, educators, as well as healthcare professionals to take up this particular very, very sensitive issue, and not to just let this young minds go into pornographic sites. So this is the role of this is the societal structure, how is going to help the parents and the siblings in the center, and with all the societal structure with the educators and healthcare personals in the surrounding where this adolescent kids can be taken care of. So it was really worth interacting with everybody in the panel. We are right away on time. It's 8 p.m. So I think one take-home message from each of our esteemed experts and panelists will be very, very helpful. We can start from TSS Rao sir. So if Rao sir is here, he's not here. I suppose he's logged off. Sumbul ma'am, can you just give one takeaway message for everybody?
Yeah, thank you, Prerna. And I will like to say that we have to be open for the discussions by the doctor. Even doctors are not talking about that. Teachers are also not talking about it. And parents, so they are not talking about it. But we should give our kids right information and what is right and what is wrong. You cannot say no to everything. You have to counsel them for everything, like what is going to affect their future life. So I think this to be made more open for discussions everywhere in school, in doctors and parents. We should not hide anything. We should talk about it, I think. This is
Yes,
the question.
Asha ma'am.
Thank you, this Sexual Medicine Committee, Dr. Kamble, Madan Kamble, and Dr. Prerna, for inviting me for a topic which I do not know much. In fact,
But your
Ma'am
interest
still he
was,
talked for one full
That is,
hour.
you can
yeah.
talk.
Ma'am, he
You can
talked for
talk for
one
one
full
hour.
hour.
and I was sorry for joining late because we had a CME and Dr. Pratik Tambe had come. So I had to join late. So sorry for that. But of course, it was a thought-provoking panel. And there should not be, idea is that there should not be any communication gap between parents and children.
Yeah.
And the
True.
children should be involved in more physical activities than
Yes.
just giving the um, tabs or a mobile phone. And they should be exposed of, okay, this is the only time that you'll be going through this, and the tabs and the mobiles of these children should have sites. These are banned. Those are the special, the parents knows, and the parents can block these sites, and they should be allowed only those very mobiles and tabs in which these sites are blocked, so there won't be any problem. Because this is the problem of our country, where the rules and regulations are still in evolving stage.
Yeah,
Mobile has come.
there
Even
is need.
sometimes I have noticed that identification problem comes if somebody has four girls and fifth girl also became. So the youngest one is being groomed by the like a boy. So neurohormonal changes comes right from that very age. So she thinks, okay, she is a girl in a she is in fact a boy in a girl's frame, or a boy in a girl's other thing. So they are being dressed. So these are also sometimes the parents also they do these sort of things. That has
Yeah,
to.
yeah, true. Rightly said, ma'am. I
लड़का नहीं
know a
हुआ तो
girl.
उन्होंने लड़की को लड़के के कपड़े बना दिए,
Yeah.
और वो
I
फिर
know a
उसी तरह
girl.
बोलता है, उसी तरह बिहेव करता है.
Yeah, rightly said, ma'am. I know of a girl that when she had puberty and breast development, she used to tie like bandage, tight bandage on her chest so that it is not
As an
increase, or it should not be obvious to other children around her because they were
That is
thinking
why
that he is a
actually,
boy.
yeah, open communication with the kids is very much important, especially the boys. We ignore the boys and only teach the girls, but
Girls,
Right.
it's the high time actually,
no,
and
so
it should
for
be done by
parents,
the
it's
parents.
both boys and
Teach,
girls. Huh?
teachers will not do. It should start from the parents only.
So first counselor has to be parents.
Yeah,
If you want
teachers
to
will not do
really eradicate these,
because
And the
problem is
parents
that
have
like,
to, and the
like
parents have to, with this change in the generation, a change in our surroundings, the parents, the mindset they also have to change their mindset.
that is our role. Actually, we have to take the more programs with the parents.
So
Parents
for
actually, they
community
and
awareness and
teachers and parents.
yes,
We have to teach the teachers because teachers
How
also doesn't know anything, and
how to
as the government
move
is not,
forward with this generation, as well as taking their safety in concern.
and as the government of India
Too
is not
difficult a situation.
for this sexuality education, and it is banned in most of the states. The teachers will not take the initiative. Not principal will not take the initiative. But as our gynae society will approach that principal or the dean, then they are cooperating with us. That is a great actually. But government is not taking any initiative. It is totally
We
banned in
also
India.
have we also have Tamkin ma'am, Yashodhara ma'am logged in till late. Can we have their inputs if in case they are there? Tamkin ma'am and Yashodhara ma'am, if in case you're there. No, maybe.
Okay.
We thank
Was
each and every. Yeah, Dr. Madan, please.
Yeah, it was really a very interactive and wonderful session. We all have enjoyed this wonderful discussion, and on behalf of this AMOGS Sexual Health Committee and Dr. Prerna, myself are very grateful to you for accepting this our invite and indulging into this very interactive session. We really enjoyed and very so much thankful to all of you, all the chairpersons, all the faculty, speakers, and all the guests. Yes,
Thank
thank
you.
you so much.
wish
We
you,
appeal for your
Dr. Madan and Dr. Prerna, all the best for your next
Yes,
assignment.
we appeal with folded hands, man, for your votes for our upcoming chairperson elections. Dr. Madan is going for Sexual Health Committee Medicine, and I am coming for Young Talent
Future
Promotion Committee.
assignments. All the best. Good
yes,
luck.
thank you so much, ma'am. Thank you.
Please
All the
keep us
best.
in your
Yeah.
blessings, ma'am.
And next Thursday, we are covering next 15 societies of UP. Today 15 and next Thursday 15 societies.
Chaliye, good luck. Okay.
Yes,
Bye.
entire UP is covered.
Oh,
Yes, thank you so much once
Thank you
again.
so much,
bye-bye.
ma'am. Bye bye. Have a nice
Bye.
Yes,
time.
Good
bye.
night.
Good night.
Good night.